amalgam check-off. And as you can see, there's more instrumentation involved with this one versus the composite. Composite had more material that you were applying onto the tooth, okay? So on this procedure, we're going to be doing 2 teeth, one of which is going to be the amalgam, the other one which is going to be the intermediate restoration, okay? So, you know, again, setting everything up from left to right, you have your basic setup, your mirror and explorer, periodontal probe, and your cotton pliers. Then you move into your cutting instrument, which is going to be I'll say it all at once.
What is it? Excavator?
Yes, spoon excavator. And then you have then your carving instruments where you have your cleoid discoid, your larger carver, and your show A. Okay. Then you have your Hollenbach. We add the composite Woodson in here just because basically this is all going to be in the package anyway that you would have as restorative, so it's here, okay? And a lot of times it is good to have and to use it when you're placing your intermediate restoration. Then you have your ball burnisher. You will have your amalgam carrier and your condenser, okay? So ideally, even though I don't want to mess up his setup because I'm assuming that he has this here in this way because it'd be the first set of instruments to use, whereas setting it up from left to right. So I figured your method, okay, here. And then of course you have your articulating paper with the forceps so you can test your occlusion, even though we know Glenn will not bite. You will have your Topfenmeyer with your matrix band because one of these teeth is going to be a class 2. And then of course your spatula to mix your material. Die-cal instrument, there probably will be a liner that will be applied. So you know you have your die-cal, you have your and then of course your anesthetic. The other newer materials that are associated with this checkoff is going to be your cavity varnish. Commonly it's called Copalite, but that again is just like a brand name, just like die-cal is a brand name. So your cavity varnish, which its whole purpose is to, once you open up that tooth, get all the decay out, and you're ready to place your amalgam in that tooth, this cavity varnish is applied with this tiny little cotton ball, okay? And it is basically placed inside the prep to seal up all those little dental tubules, because you know that's where all your nerves and all the alive stuff is, okay? Because you're placing a metal material in there. So it does help cut down on sensitivity. So seals up those dental tubules, okay? The one thing I would tell you about this is that do not spill it, okay? Please. As soon as you uncap it, dip your cotton ball in it, and then recap it, okay? This is your amalgam. You can shake it and it should have some movement in it. They come in different sizes of pellets material in here. They call it a spill, so 1 spill, 2 spill, 3 spill, 5. That guy's like Dr. Seuss. But essentially, they're all delivered in these types of capsules. Some capsules you have to push them together in order to activate the material inside before you put it into the amalgamator. This one you don't. We have others that you do. Again, it's a menagerie of what I may have because it's donated from the offices, because you know offices don't use it anymore, okay? I would ask you that once you put it in your amalgamator, okay, it fits in between these 2 prongs like so, and then you have to close the lid, otherwise it is not going to operate. I'm not going to turn it on now because we're not using it yet. But you just push the button, it's going to make a sound, and then when it's done, it'll shut off. You reach in here and you get it out in some way, shape, or form. It must be a two-hand effort. And then you will open it up, it unscrews, and then you put it in your amalgam well. And this is going to be what you'll see him drawing it up into the amalgam carrier. Okay? So, once you're done with this, I personally would not recap it back together, because if you only used one and you lay it capped over here, what do you think is going to happen when you clean up? You're going to put it back in there. So the next person comes in, they drop a handful onto the thing, and then of course they lock the draw, pick up the empty one. They don't notice that there isn't any movement in it, and then they go in and put it in there, and they open up and there's nothing. Okay? It should be a solid ball, okay, that comes out of this. Like I said, some of this stuff is old, okay, so if you open it up and it's liquid and a powder, then it didn't get mixed, okay, just throw it away and then get you another one, okay. We have run across that. I just haven't been in the position yet to have to purchase this stuff, so to get newer material, because Glenn doesn't care, okay? And if I still get stuff donated from offices, by all means, I'll accept it. Excuse me, so I don't have to put purchase it. When you're setting this up, obviously you have floss and wedges. Those go with your Toffenmeyer. Okay, always got cotton rolls. But when we tell you, like, you're gonna ask us, what are we doing today? We'll do like the Mirror and Explorer, hand that to us, and we'll say, oh, it looks like we're gonna be doing a DO on number 29, amalgam, and then we'll do the occlusal on 30, okay? You hear the word DO, that is a class 2, that means that's going to be the one that's going to be used for the matrix band. You can go ahead, while we're waiting for the patient to get numb, and go ahead and set up your matrix band. Go ahead and get that out of the way. That way it's already set up, okay? You are going to be the one to put it on, not us, okay? And also the one to take it off. I know there's one thing that we didn't quite, maybe not go over when we did this as a check off before, but there's a little method that you should take this off. You just don't take it off, okay? Because of the fact that you have a filling in here that's needing to set up, and amalgam only takes time and not activated by a light. So the method of taking this off is to unscrew your Toffenmeyer, take it off, set it to the side, and then take your cotton pliers and gently work that band out. Okay, obviously you take your wedge and everything else out, but you just don't. Sometimes it comes off all at once, but for the most part, you're going to want to try to take your Toffenmeyer off first, and then wiggle carefully your band out, because again, that filling material still isn't not set up all the way, and you don't want that thing to fall out. Now, on human teeth, the filling material does stay in a little bit better. On plastic Glen teeth, it does its best. Okay? But you know, it's just a matter, if you do wiggle it carefully off, then it usually does stay in there. Okay, so is there any questions initially? Okay. Glenn.
Showtime.
Oh, while he's getting his instrument. Cutting burrs for the most part.
I'm glad I'm not.
You can put a couple finishing burrs on there, but what we're looking for mainly is a friction grip cutting burr and a friction grip contra angle burr to go in our slow speed and high speed. Okay, so you know, at various sizes. Okay, again, but that's what we're looking for. Sorry, Glenn, I hate to manhand you here, but turn your head. Don't do that to your patient. Yes, he was part of a tribe down in the South American jungle.
Good for him.
We removed all his sapphires and rubies.
He probably got some change on that.
Yes, he's cashed them in for Christmas. Since inflation and everything else, yes, he sacrificed his jewels. Okay.
Tough times.
All right. See, let's see what we're gonna do. Let's do 18 and 19. I have no idea what this is. Looks as this temporary filling is very gloppy. So I'm thinking it's underneath all of that. I think the occlusal is 19 and the MO is 18. Good thing we didn't grade them on their quality. Do a little inferior alveolar injection.
So far, none's changed from composite. Still the same stuff.
Oh, we're doing a long buccal injection since.
Still trying to get
I'm hoping to purchase. It's a head. It sits on a desk and it actually has like pads back here to simulate gum tissue, and that if you push the needle in, if you go in the right spot, it dings or makes a buzzing sound. But I think that would be helpful for you guys to see exactly, because obviously we can't allow you to do it yourself, but be able to see inferior alveolar, long buccal. I mean, buccal, is cheek side. Inferior alveolar will be back here. But we'll see. And it's set up correctly. We're going to give you injections. Do a little work on the cheek. Okay. Rinse out your patient because it tastes like death.
got a piece of temporary film.
Save me from drilling it. So, on this side, the operator would retract back the tongue. Again, get your fulcrum established. Glenn, baby, you're going to have to open. Is that all you got?
My jaw hurts.
So, I'm just taking out all of the other filling. There is a temporary filling is 19.
Is that simple? Oh, the biggest deal.
Yep, that's just enough for you. And then there's an MO on 18. Brain buddy, open up. Switch birth.
I need everything in a video.
All right. Still sticky. Decay there. So go through again the motions using your spoon excavator. You know, in amalgam restoration, there's more to structure that is removed in order to house the filling, because the material again has made to stay in there by the grooves that they have put into the structure of the tooth, versus a posterior composite just needs smoother walls because of the fact that it's light cured and how it's packed in there. Okay, I'm ready. Alright, so we want to put a liner in 18 with the matrix band because it's going to have an amalgam, but we need the for 19. Let's do the one. Put you to the test, Mr. Collier. Do a scaling. I don't know what's in here. Alginate. Ooh, a lot of alginate. Getting the angles.
Oh, there you are. Good job.
Trying to do your directorial debut. So Glenn, it looks like this decay on number 19 on your first molar is pretty deep. Not sure what it's going to be doing. So what we're doing right now is mixing up some temporary material, and we're going to place it in here and kind of wait it out and see what it's going to do. Pack it in there. Again, it should be dry-ish. Now, what? I need that. What tends to happen on plastic teeth It doesn't like to stick. So, doesn't mean that you didn't mix it up well. It's just that you have to be gentle on taking it and putting it in here. But it doesn't quite stick to plastic teeth very well. So all I'm doing right now is just filling in that occlusal surface with okay, now you can wipe that off. I don't need it.
Teamwork.
And one thing that you may see me ask you to give me is the cotton tip applicator that you use for your topical. Because it's already lubricated, you can kind of use it to smooth down. Some dentists think this is barbaric, as one said. But the other one that taught me to do this said, wow, it's already lubricated and then the material doesn't stick to it. And anything, it ends up being cherry flavored. And it doesn't disrupt the setting up time. So it makes it smoother. Okay, so we need yes, before you put that matrix thing. So what is the purpose of the liner?
For sensitivity.
Well, I'm talking about a base. I'm sorry.
Oh.
Wrong word. What's the purpose of a base? What's going on inside this tooth that I have to use one?
And protect the pulp and stuff from being exposed.
Right, this could be a rather deep filling because it had a lot of decay in it, and we could be close to that little pulp chamber down there. So I'm placing some of this right on that area that I can see that it's deep for the dentin hopefully to regenerate and not cause us any problems.
So,
Huh?
so we hope.
Let's hope, yeah. Okay, so it is an MO on 18, so he's going to be putting a matrix band. How many wedges? 1.
5 bonus points. Right.
Just like you did on your checkoff, you make your loop just big enough to fit over the tooth, so you have all that extra you can tighten the band on. You know, it comes out from the buckle, just to refresh. Sometimes because these are rubber, okay, you get a little bit of resistance to these things. There's a little bit more give to the human face. Alright, so I'm gonna get my wedge in here. There it goes. Knew that wasn't too easy. Alright, down up towards that cervical edge of the tooth, I put my wedge in to close that band around the tooth. Now he's going to give me the lovely smelling cavity varnish.
I know what it smells like, huh?
Yes. Amalgamator's probably older than all of you. Maybe not me,
I was thinking
but definitely
around
most of
me.
you. So it has a little pellet here. That's what it mixes into. There's like a little, like a diaphragm that comes in there that separates the wet to the dry, but it should turn into a nice pellet. Okay, that he will mix up. So when you push this up on the side of your amalgam well, okay, if you get where you can see him doing that, and just make sure you don't have your finger on the lever there because it would defeat the purpose. But push it up against the side of the well, just like you don't load a gun with your finger on the trigger. So I just push that lever and dispense the amalgam down into the tooth. And then you hand me the condenser. And then you just push that amalgam down into the tooth. You as the assistant are going over there and filling up your amalgam carrier with some more. That should be it. Now, when you're doing this on a human, obviously you always got to keep in mind your patient has active salivary glands, so while you are doing all of this, you need to pay attention to your patient because they're going to need to have suction. And as the dentist is condensing this material down into the tooth, little pieces are going to fall, okay, into the patient's mouth. So you'll have to take time to use your suction. This is where, again, multitasking as an assistant is a must. Line, keep your mouth open. Alright, so it is full. I can't press down any further. So as I'm carving, you hold your suction because there's going to be pieces that are going to fall off of that prep. So I'm taking away excess. And again, all you're doing at this point, you're carving the anatomy back into the tooth. We'll probably want, back and forth on this different carvers. This is where we see your instrument transfer skills. Okay. Alright, go ahead and get the Explorer. Once I'm done carving, then I need to clean up around that band. And in the Explorer, I just run it along the edge of that band. And it cleans out all the excess that's just kind of floating off to the side. And it also, where it is an MO, it gets any additional excess that may be there. So when we hopefully take off this matrix band, it's nice and clean. Okay, he's going to remove, or I am, the wedge. And then he's going to remove the matrix band. So again, release your Tofflemire first. Keep your finger on the band to help holding it down. So just gently pull your Tofflemire off, and then your matrix band, kind of wiggle one side with the other and just carefully remove your band. You don't just yank it out.
You killed Glenn.
I'm sorry.
Rubber dams are a good thing in this situation. Okay, so seeing that I had an interproximal filling, I need my Shoei or Holland back, because at one end of your Shoei is like a Holland back, and that is to run along the interproximal sides of the prep, just to ensure that there isn't anything interproximal. Okay. And I'm good with that. Let's do floss real quick. You'll see floss being used, and then we will test the occlusion before we burnish. Okay, Glenn, I need you to go ahead and bite up and down. Chew around on that like it's a piece of lettuce. Never knew you chewed lettuce. And then if you see any blue marks that are right on that occlusal surface, then you're going to want to use the carver. Okay? If there isn't and everything looks hunky-dory, then you will want to burnish all your little hash marks that you created with the with the carvers. And you'll see with the burnisher, it will also, if there's any excess that's around a cusp or anything like that, you know, it will take it off. But you'll see that it really smooths out the amalgam, hence the word burnish. Okay. Then you do you wipe off the blue marks. You can use a cotton roll, you can use a gauze, it doesn't matter. You want Glen to be nice and pretty and then you do your final rinse. Then post-op instructions.
Alrighty, Glenn. So you have been laying down for a while, so you want to be careful when you get up. You may feel a little dizzy. We have a temporary filling in there, and so we're going to do a watch on it, get you referred over to Dr. Bishop or Watley for a root canal. And on your actual amalgam filling, it takes about 24 hours for it to fully set. If you have any sensitivity to cold, that is possible. If you have any pain, you can take an over-the-counter pain medicine, Advil. But if the pain does not stop, call us immediately. We'll get you right back in for another appointment. Take a radiograph on that. If you want to give me $1, you're more than happy to do that.
Take tips.
You do take tips. And if you feel like your bite is off, after the anesthetic wears off, it's going to take a couple of hours for that to wear off. So if you feel like your bite is off, give us a call. We'll get you back in, adjust your bite, and be careful. Don't chew on that side. You have a temporary filling in. You don't want that to come out, so try and avoid that side as best as possible. And thank you for trusting us with your smile. You have a nice day.
Good job.